and welcome to Career Conversations, brought to you by Monash Health Science Society. My name is Pearl, and I will be your host for today's show. Through this podcast, we will be exploring different careers in health. Before we start, I'd like to acknowledge the people of the Kulin Nations, whose land we're meeting on today. And we pay our respects to the traditional owners of the land on which everyone is listening. We pay our respects to their Indigenous elders, past, present, and emerging, and acknowledge their continual connection to the land and waters. Today, we are very excited to be joined by Sasha Hermosa. Sasha graduated from the Bachelor of Public Health Science in 2018 and from the Bachelor of Health Science with Honors in 2019 from Monash University. During her studies, she has completed a number of internships and held various roles in research and health promotion. She currently works as a project officer as part of the COVID-19 Taskforce with the Department of Health and Human Services, specifically focusing on data and intelligence. Welcome, Sasha. We're very excited to have you today.
Thank you for having me.
Perfect. Moving on to our first question. Let's start from the very beginning. Sasha, what got you interested in the field of public health?
That's a really interesting question. So I became interested in the field of public health through my initial fascination with medicine. I initially wanted to pursue medicine and become a doctor when I was quite young. And for this reason, in my youth, I would just, attend open days, but only attend the sessions surrounding the Bachelor of Medicine, for example. And my scope of search was really limited to that. But then I started to have doubts about this career pathway, maybe around year 11, year 10, and I was really questioning whether this is something that I really wanted to pursue. And as you know, doing a medical degree, that takes years of commitment, a lot of study, and it's not easy to just change your mind when you're doing your degree in medicine. So around year 11, I started to question this career pathway a little bit more. So I caught up with so my mom's a nurse and she has friends in the medical field, and I started to ask them about the day-to-day life. And I met someone who completed a master's of public health, and that was, I think, the first time I heard about public health, really. And I started to research a bit more about what public health is, what's the definition, what kind of work do they do. I also found out about epidemiology in year 11, which at the time no one knew what I was talking about. But I knew from that point on that was where my values lie as a person. And I was motivated to pursue medicine because I wanted to help people, but I also was quite involved in some of the social justice activities in high school, where a lot of the focus was on some of the public health challenges. But at the time, it wasn't framed as a public health challenge. They were just framed as like a social justice issue, but there's a lot of overlapping features with public health and social justice. So then I thought, I think I'm better suited to this role. And I also don't think I would be good as a clinician there's a lot of like one-to-one interaction. I didn't think that was for me. So, yeah.
Lovely. What is the favorite part of the current role that you have? And can you tell us a bit about that role?
Yeah, so currently I am supporting the COVID-19 work at the Department of Health and Human Services. So I was, funnily enough, I was actually recruited. So at the time, I was applying for another role for another government agency that's federal. And I was contacted by the HR person from that agency, and they said that, hey, we notice you're a Victorian resident. Do you mind if we pass on your details to the state government, the State Department of Health and Human Services? Maybe you're interested in some of the work that they're doing to support some of the because there's a lot of work that needs to get done,
Mhm.
and they needed a lot of people at that time. So I guess luckily enough, I that was my route into getting into the Department of Health and Human Services. And what I do on a day-to-day basis varies, but really I work in the data and intelligence team where
Mhm.
I do a lot of the data entry and data reporting, where I collect a lot of different pieces of data from different people, from stakeholders, from people who work on the ground, who
Mhm.
collect this information face to face. Um, and then I create those deliverables, and then I send those deliverables off to a number of other people who make the really tough decisions around, well, what should we do now, given the data that we have here?
Mhm.
Yeah.
Um, and what would you say is the best part about your job, or you think you enjoy the most?
Well, I do like the looking at data. I know that's not something that a lot of people can say because a lot of people find data to be boring, but I think it's really interesting to be able to monitor behind the scenes what's going on and
Mhm.
see what's changing day to day. But I also enjoy the I guess this is a common theme in public health generally, but I really enjoy the ability to work in a multidisciplinary team. Not everyone in my team and even my boss has like a public health background. So that's one of the challenges, but also one of the strengths of working in this type of environment. I think in the whole team, there's me and maybe another person in like a group of 10 who have a qualification in public health. And so, really, the teamwork, the collaborative aspect of my day to day job, of this job, is very, very interesting, but also probably the best part of the job because I think there's a tangible um, feeling of like we're all trying to work to achieve the same goal regardless of our backgrounds, if that makes sense. Yeah.
Yeah. It's actually good to know that you enjoy that kind of collaborative work because, in general, when you mention data, people tend to get very intimidated by the whole topic.
Yeah.
And a lot of people actually assume that data is a very segregated job as such, like you do everything on your own, there's no teamwork involved. But
Mhm.
when I guess in a role like yours, there's a lot of collaborative work to be done together in order to, when you work with really large data sets, I
Mhm.
guess teamwork is really important there.
For sure. And we always, the data doesn't tell us anything. It's really the people who are managing the data who um, get to be a little bit, you have to interpret the data and you have to interpret the data safely and in a way where it's fair and equitable to everyone in society. And that's, I think, the thing that people miss when we talk about data and evidence. It's not just looking at numbers, there's a bit more to it, a bit more nuances to it.
Coming to your time at Monash, Sasha,
Mhm.
how do you think your time at Monash and what you studied, other skills added, what helped you probably, prepare for your role today?
That's an interesting question. So I would say, actually, a lot of the assignments from memory, a lot of the assignments that I did during my Bachelor of Public Health Science degree. So, for example, a lot of the reports and um, like the literature reviews, for example, those are very much in practice in the real world. That doesn't go away. So that's something that's actually quite concrete, and it's a good way to practice those skills early on because
Mhm.
that's something that does genuinely exist in the world. Something that also helped were some of the extracurricular activities I did at Monash. So, for example, some of the little things that you might not pick up, but like when I was involved with Monash Health Science Society years ago,
Mhm.
you had to be able to delegate roles and responsibilities, organize meetings,
Mhm.
contacting different stakeholders, figuring out where do we get money because we always didn't have enough money to do what we wanted to do.
Yeah.
So those are really good skills that are very much transferable in the real world.
Hmm.
Yeah.
So, in addition to grades, because again, as students, I think we give, I think, more importance than is required in terms of
Mhm.
the job market. uh, Employers probably look for more than just grades, I'm sure. So what would you say are skills other than your grades that are important when you're looking for a job?
Um, I think so. Grades are important to an extent in that if if you have decent grades, not necessarily like 90 to 100%, but if
Mhm.
you have decent grades, that shows that you have a decent amount of work ethic and that maybe you are actually interested in some of the units that you're doing,
Mhm.
and you respond to some of the the requirements of the assignments. So to a degree, your grades does tell a story about who you are a little bit as a person, but it's very superficial. So I wouldn't discount grades completely, but don't fully focus on grades, especially if that's something that you are concerned about.
Mhm.
What I would say as important skills in the workforce, well, particularly with my government job, is adaptability.
Mhm.
Every day you have to be aware and you have to be able to communicate the changing priorities, and you have to adapt, given the constant changes at work.
Mhm.
But you also have to be a little bit comfortable with that.
Yeah.
So I guess I don't know if it's a skill. I guess it's more of an attribute. So being able to adapt, but also being able to have uh, a level of resilience and a level of, I guess, a good attitude in that if you were complaining that the priorities have changed and that's all you do, that doesn't really look good on you, and it
Yeah.
doesn't make you a good team player. Like it's quite difficult to work with people who are complaining, and especially if everything is, if a lot of things are out of your control, for
Mhm.
example.
Mhm.
um and you might notice, I don't know if you personally have applied to some of these entry level jobs or some of the graduate programs. A lot of the questions are behavioral type of questions, and what they're really wanting to find out is how well do you respond in a high pressure environment. When things change and you're not happy, how do you respond to that? What's your attitude towards that? Can you actually adapt if things don't go your way?
Mhm.
um, if you're uncomfortable, do you speak up? Do you communicate it? How do you communicate these issues that you are facing at work? Those
Mhm.
are the things that your grades can't articulate.
Exactly.
Yeah, yeah.
Mhm.
And
So
those are probably more important because that's what makes you, that's what differs you from a very studious, very thorough person to, say, a more of a comprehensive, like, whole package
yeah.
employee. Yeah.
Mhm. So in short, just basic resilience, adaptability, and just the ability to not dwell on something. In
Mhm.
fact, maybe accept it, come up with a solution, and move forward.
Yes. I guess the more succinct word is like being proactive, taking initiative. So this is some of the keywords that they use a lot. Being a good team player, communication, all that sort of stuff. They're very, very important.
Mhm. Moving on to my next question for you, Sasha.
Mhm.
During your job search, how did you prepare for the process? Are there any pointers you could give to our students? And what, according to you, is the most important part of the job search, you'd say? Like the really crucial bit?
Yeah. So if you were applying to a job in a traditional way, so submitting your resume and a cover letter and completing the key selection criteria, I think the advice is pretty much the same. Make sure that these documents are tailored to the position you're applying for. If that's something that you are not familiar with, or you're not very confident in doing, then there's Monash Connect. I think that's they are a very useful service, and it's free even after you finish. I think even 12 months after you graduate from Monash University, they still can help you out with that. And they also do mock interviews and mock group assessments from my memory. But I would say the most important thing during a job search as well is networking and maintaining these interpersonal relationships with everyone you meet, really. From, say, your lecturers and your tutors to the more senior person at like the Cheers to Careers event, for example, or say you're attending a public health conference or a special interest group session, for example, or a webinar, not a webinar, uh, I guess webinar. You still can meet people, talk to people, email people. Just being able to have that confidence and be brave um, definitely helps. And not only making that initial connection, but also try and maintain those connections, especially if it's a field that is quite competitive or quite hard to get into. Your networks are very, very important. And as you may know already, government jobs, that's quite difficult to get into. Something else that's really difficult to get into, I think, from memory, is global health. Getting into WHO, UN, that kind of job, that's also very difficult, but networks are very, very important in this context. Funnily enough, I think in the last um, year and a half, I'd say, all my jobs have been through a network. Someone emailed me or someone called me or, yeah, saying, hey, I remember you from this, and I know you did some work in this area, or you have a certain skill set. Could you work for us part-time, for example? And that's actually that's been the my experience so far. I haven't had to do the full traditional applying the job with all these documents and then doing the interview and group assessment, etc. That's why networks are very important. I can't stress that enough.
Yeah, and is there anything specific to say government jobs in particular, especially in
Yeah.
in line with your role?
Yeah, so I guess mine's a unique situation in that I was recruited for the purposes of supporting the COVID-19 um, work that the government is doing at the moment. Government does a thorough job at looking at every single applicant, and the recruitment process can be sometimes tedious but also very comprehensive. So, for example, with the graduate program, that's definitely one of the most popular and but also some of the most competitive programs out there, because it is an entry level job, and once you get in, job security is almost guaranteed for you. However, keep in mind that there's more to you can apply to other jobs within government. You don't have to wait for the graduate program application to open up. You can apply for if you go on the Victorian Public Service website. I think VPS level 2 and 3 and maybe even 4. That's definitely um, a level that fresh graduates can apply for, and they don't necessarily have to apply to all these specific graduate programs. And you might find that sometimes VPS 2 to 4, for example, jobs are probably a lot more straightforward and takes less time to hear a response back from the recruiter. And also, there's a lot more of them, I think, in my opinion. Especially at the moment, there's quite a lot of job openings on the VPS website. Yeah.
Perfect. Thank you for that pointer, Sasha. I know
That's all
our
right.
friends would be keen to know where to look because a lot of the times I think there are jobs, but we're just looking in the wrong places. So
Definitely.
people kind of have that notion that there aren't enough jobs out there, or I don't fit the bill. But I guess they're just looking in the wrong places. So it's useful to just have someone point us in the right direction.
Yeah.
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 Coming to my next question, Sasha, in your bio, it mentions that you've done internships. And in terms of procuring these internships, how did you go about finding these internships, or even in terms of volunteering?
Mhm.
How would our students go about looking for these opportunities? Because even with COVID at the moment, it's really difficult to get hold of such opportunities.
Okay. Well, I don't really have experience doing an internship whilst COVID-19,
Mm-hmm.
during COVID-19. I don't have any experience in virtual internships, so all my experiences are from pre-COVID-19, obviously.
Mm-hmm.
But from my memory, so I've done two, I think it's two internship placements through Monash University, and I think I'm trying to remember where they advertised it. I think I would always. Oh yes, that's right. There's the summer and winter uh, research internships or research scholarships,
Mm-hmm.
and I applied for one during winter,
Mm-hmm.
and that was actually a unit, but it was a skills based unit whereby I was placed in a multidisciplinary team of students.
Mm-hmm.
I had one international, and it was an international based program as well. So Monash University Malaysia and Monash University Australia partnered up to complete this winter unit, and it was select entry as well. And in this program, I, alongside three other undergraduate students, we completed uh, grant application, and we were basically competing to win money to support our research at an undergraduate level. We were successful and we won a certain amount of money that helped us fund a conference the following year.
Mm-hmm.
Uh, and yes, so that was that. And then I also completed a summer internship at the end of my third year. So basically, after I finished my third year,
Mm-hmm.
and that was with a government agency with a primary health network in Melbourne.
Mm-hmm.
And that was also just after browsing the summer and winter internships on the Monash University website.
Mm-hmm.
I At this point I was just very aware. I just tried to make sure that I'm aware of all the opportunities that Monash provided to all its students, and that was something that I was aware of. That Monash does these winter and summer scholarships, so I took advantage of those because at this point, it, even after completing 3 years worth of study, I still felt like I didn't do enough hands-on, tangible work in this field. So I
Mm-hmm.
wanted to get a head start, I guess. And then I also did uh, in my second year, I think, the summer research scholarship, the summer vacation scholarship with the School of Public Health and Preventive Medicine. So that's a research-based internship as well, where for a month in from November till December,
Mm-hmm.
uh, yeah, in my second year, I completed a research internship with uh, and you get paired up with a team or an individual researcher who's a bit more senior in the field.
Mm-hmm.
Um, and I completed that, and some people did get a job doing that internship and stayed on as a part-time research assistant. So that's also a good avenue if you wanted to gain more experience in research.
Okay.
And in third year, I don't know. Is the health promotion student placement? What's going on with that? Is that still?
I think that's still there.
Yeah.
If I'm not mistaken, I think they have certain tie-ups with other
Mhm.
people because I did hear about this that people doing their bachelors they still had an opportunity for placements. So
Okay.
I'm not sure how it works in terms of how you go on to study it or which stream you opt for.
Mhm.
But just at one of the places I was interning, I was aware that they were taking Monash students on health promotion placement.
Okay.
Yeah.
Are you second year or third year, Pearl?
I'm actually Master of Public Health.
Oh, okay, interesting. Right. I just assumed everyone is still doing their undergrad. Okay. Yeah, so I also, in my third year, I also completed a health promotion placement.
Hmm.
At the time, this was organized by Michaela
Oh, yeah.
and Sarah. Yeah,
Mhm.
yeah.
Yeah, Sarah taught us. So, yeah, I'm aware. She's all game for placements and she's been pushing for it for a while.
Oh, good.
Yeah.
Cool. So,
Um,
yes. So,
yeah.
I've completed a number of internships and placements as part of my degree or outside of my degree. I also did some volunteering, and how I did within public health research, and how I did that was really, I think it was like one of the honors information night. You know, they have all these stalls, and sometimes you just need to tell them, "Hey, I'm very interested in, for example, diabetes research. Is there an opportunity for me to volunteer my time and help out with some of the research, some of your research, for example?"
Mm-hmm.
And people might find it surprising, but a lot of people, a lot of researchers and public health professionals are really keen on taking on board young people. They always need help to some degree. So yeah, don't be shy is my main message.
A related question, Sasha.
Mhm.
About your time in honors, how did you come to the decision to study an honors here?
That's a really good question. At this, when did I make that decision? I think it was halfway through my third year, maybe towards the end of my third year. I was really thinking hard about should I do honors, because at the time it seemed incredibly intimidating. I mean, I'm not sure if you're aware, but in an honors research program, you are expected to complete a 15,000 word thesis at the end of your program. In addition to doing your own data analysis, sometimes your own data collection. Sometimes you have to develop your own tools to collect the data, but also you have to present to a group of people, not just your peers, but sometimes you'll have an audience of other researchers, and that's quite intimidating. At this point, when I first heard about that, I was really scared and I didn't know if I could do it. But I have met people who have completed the honors degree, and everyone said it was very challenging. That's granted. But every single person also said that it was highly a rewarding experience. And for a lot of them as well, it was a good, it was a good, I mean, it's not even a full year worth of experience. I think it's only like 9 months really, from start to finish, to do all of that. But within those 9 months, you complete so much, and you develop so many skills that you never thought you were able to uh, develop within such a short time span. And that alone, I thought, yeah, I maybe after third year, I don't know where I want to go. I don't want to make a bold jump or commitment to, say, research or health promotion. I was just a little bit confused. I was confused because I was interested in so many areas in public health and I loved everything. So I think doing an honors was just a good way to slow down, develop all these skills while you can. And even though it's in a research capacity, all the skills that I developed during my honors degree were really useful in a non-research role, if that makes sense. Like, for example, in my government role, in the data and intelligence team, they use a lot of statistical packages, all these softwares. And even though during my honors year, I was only familiar with and only used one statistical software, when I started my DHHS role, they used I think three or four. At that point, I didn't. It wasn't intimidating to me. Like, there was things that was familiar to me. There was some similarities with my experience with one of the statistical packages that it wasn't daunting to me, and I was a bit more confident. And yeah, it was a lot easier for me to adapt to all those other programs. So I think, yeah. So I definitely, it's not an easy decision. You do have to really think about whether or not you should complete an honors degree. It's not for everyone. If you know by now that you really dislike research, like full stop, and you really are interested in, say, community health, health promotion, global health, um, maybe don't jump straight into honors immediately after third year. Maybe have a think about it. maybe gain some work experience somehow, or volunteer, or take some time,
Mhm.
because it is quite a 9 months is very short, and it's a very fast paced environment doing an honors degree. Yeah.
So, in a lot of ways, Sasha, the honors degree actually prepared you for your role in the government space because we're aware of how fast things move and how
Mm,
ready you have to be to just jump into things and hit the ground running.
yes.
So, in a way,
That's
kind of, prepared you for your role today.
that's a really, really good connection, Pearl. Yes, that's right. You had to pick up a lot of skills, and you have to be comfortable with the unknown and the uncertain things going on during an honors degree, and especially because at the start of your honors program, you have a research question you're trying to answer, and pretty much 6, maybe 7 months out of the 9 months, you're still not sure if you're actually answering your research question. You're still not sure if you have enough data. What approach should I take in terms of answering this question? So, uh, honors definitely helps you getting comfortable with the uncertainty. Yeah.
Um, Coming to the next set of questions, Sasha,
Mhm.
it says here that you've done several research roles in health promotion and various other areas of public health. What advice would you give, Sasha, to undergrad students who are interested in research?
Um, if in your degree there are opportunities to complete some sort of research placement or a unit in research, definitely go. Please do it if you are definitely interested in research.
Mhm.
Um, there are lots of courses online as well that are free. If you wanted to upskill, say you wanted to learn a particular statistical software, or learn how to analyze numbers, for example, or how to visualize information. There are lots of avenues for that online. Yeah, basically similar to what I've already said before. Um, don't be shy. Definitely be bold and ask people who work in the research space if there's any opportunity for you as an undergrad to um, develop these research skills. Maybe they need help with even just like data entry and very basic analysis. Maybe help with writing up research papers, for example, or
Mhm.
even conduct very simple literature reviews. There's always work that needs to be completed in research. Uh, be friends with your lecturers and tutors. A lot of them also work in research, not just in teaching, academia, all that sort of stuff. Um, yeah, I think that was pretty much my approach during my undergraduate degree, is constantly be aware of all the opportunities provided within Monash University. You can
Mhm.
also branch out and look at other external organizations. For example, I think Cancer Council also does their own version of a summer vacation research scholarship program thing. And they also hold that during the summer break. So keep in mind, Monash isn't the only institution that provides these opportunities.
Yeah. Um, Coming to your job again,
Mhm,
Sasha, what do you think is changing in the sector now, in the sector you work in, which
mhm.
is primarily the government sector dealing with the COVID response? And what does the future look like for careers like yours?
Good question. So it depends which area of the public health field you are interested in. So for example, government jobs and government positions normally, they're it's a bit more of a secure choice. So if you work in government, job loss isn't as big of a threat, say in like academia, where a lot of the jobs are dependent on the funding and the budget, and the cuts, for example. And academia has taken a large hit. Universities have taken a large hit due
Mhm.
to the COVID-19 pandemic. In the short term, I mean, this is just my assumptions, so not evidence based, but I have a suspicion that there will still be more emphasis placed on COVID-19 related um,
Right.
activities. So, how do we manage? How do we recover from COVID-19? Um, I don't know if you're aware, but the budget was announced not too long ago.
Mhm.
Unfortunately, in that budget, even though there's a lot of emphasis on a public health response toward such a massive emergency and the need for a strong, well prepared public health workforce, the budget that was announced recently doesn't necessarily reflect that. In fact, public health receives a ridiculously tiny amount of funding in the whole health spending pool of money.
Yeah.
A lot of that money goes towards, say, treatment, hospitals. So clearly, there hasn't been much of a shift in terms of how we should fund preventive versus treatment services, at least in the next in the short term.
Mhm.
Um, I think also in the budget they also mentioned that the federal government is committed to develop, uh, committed to fund more mental health programs, both in relation to COVID and also just broadly mental health programs. That's also something that is I guess I expect to also increase. So the mental health prevention of mental health and suicide. I think that's also something that is a longer term commitment by the government. So hopefully that stays. But
Mhm.
really, those are probably the two main themes, main domains that the government is focused on in the short term. I can't I can't predict what's going to happen in the future. These are all just my assumptions and my experiences, really. Yeah.
Thanks, Sasha. Just another very general question.
Mm.
What would your advice be? It could be career related, it could be study related, but in general, what would you tell other health science and public health students right now who are probably going to enter the workforce? And a lot of them are seemingly discouraged at the current situation.
Yeah.
So, any advice to our students?
Okay. It was, I guess, one of the best advice I got from, funny enough, from another public health careers night in the city last year, hosted by the Public Health Association of Australia.
Mhm.
And one of the guys who presented, he told me, if you're young and if you're not entirely sure what you want to do, focus on breadth, not depth. So that means you would want to diversify your skills and your experiences early on. And but these are more superficial um, skill sets and experiences. So uh, make try and maybe volunteer or work in health promotion, in health policy, local, state, or federal government. Diversify your skills and your experiences in that regard.
Mhm.
However, if you are interested, say, I'm so interested in biostatistics, I want to become a biostatistician, that's it, I'm not interested in anything else, then go ahead, pursue, say, your master's in biostatistics, reach out to people who work in biostatistics, and yeah, go on from that's your career pathway. That's pretty straightforward. But other than that, focus on breadth, not depth. Especially for people like me, I'm very interested in so many different topics, so many different parts of public health, that it's very difficult for me to make a strong, committed decision right now. Um, I would also say get involved with some of your, and you may not be aware, but there are some public health organizations that exist, like the Public Health Association of Australia. There's the Australasian Epidemiological Association. If you're interested in epidemiology, for example, you can sign up as a member, as a student, which is a lot a lot less costly. You can volunteer for those organizations as well,
Mhm.
and that way, that's what I did actually last year. They had an event, professional event last year, and I volunteered, and I met a lot of people. Some people from the UK, and they were telling me their experiences, and then they started to give me ideas. Oh, I can actually do this and go here, and you know, I didn't know this exists. So there's always new career pathways in public health, and especially with the new, I guess, the technological era as well. There's like a lot of overlap between public health and say data analytics and machine learning. Um, and now that we're also living in a very globalized world, there's a lot of research teams and global health teams that work country with another country, for example, or region and region.
Mhm.
Um, so yeah, volunteer, focus on breadth, not depth, network. I think I've kept saying that throughout this session. Get involved in your extracurricular activities, be it volunteering, join a club, take up a leadership position, all the things that your grades can't narrate about you as a person. Um, and if grades aren't your strong suit, your academic grades aren't your strong suit, then this is definitely something that you would want to take up,
Mhm.
especially while you're still studying.
Yeah,
Yeah,
that's indeed really good advice, Sasha. Um, I think from a person who's at the master's level now,
yeah,
it, it really matters because after a certain point, people don't really look at your grades anymore. They're more interested in what you bring as a person.
for sure.
Yeah.
And just as a side note, I mean, when I got recruited to the government job, they didn't even ask me for my academic transcript. I don't think, or they at least they weren't. At least when I first met my boss, my team, they
Mhm.
were really asking me questions about my work experience.
Yeah.
They really didn't ask my grades or you know, are you the top of the class or what was your GPA or
Yeah.
you know.
Mhm.
So yeah.
Lovely, Sasha. Before we wrap up on a lighter note,
Mhm.
studies and work aside, um, what really inspires you and what brings you joy during this time? How have you um, balanced your work and in the current environment? What do you do to just relax and take time off? Is it like what do you do for a hobby or something you've been just doing recently?
Um, In terms of personal hobbies that bring me joy, I'd say cooking and baking. I guess those are my COVID-19 hobbies that I picked up.
Mhm.
Um, that's definitely been a source of fun for me. Not great for my waist, but you know, it's nice to be able to feed the family and treat them once in a while with baked goods,
Mhm.
and it just gives you an opportunity to switch off during the working week. I mean, it's I guess when people talk about doing a mindful activity, it
Mhm.
doesn't necessarily have to be meditation or say yoga.
Yeah.
Washing anything that naturally switches your mind off and you'll focus on that activity. That's a mindfulness activity. So I guess yeah, cooking and baking. That's something that I do in my during my off time.
Mhm.
And in terms of what inspires me, I guess I mean, I'm very much involved in my work, and I love my job.
Mhm.
And I also teach as well. I don't know if I mentioned that I teach at Monash University, and I teach a group of first year students all about the Australian healthcare system. And so I guess they bring me joy, and they also inspire me. Um, but also being able to just work in a team environment that identify themselves as public health nerds to some degree. That's always nice because at home no one's really interested in me talking all about public health and all my interests. They have other interests, they have other jobs, so it's really nice to be able to just chat to people at work, um, and feeling like you are working towards a goal that's good for the community. So that, I guess, is my main source of inspiration, the people.
Mhm. Thank you, Sasha. Thank you so much for joining us today. That's all the time we have. And thank you so much for all the advice you've shared with us. I think Beverly would agree that some of the advice and the snippets of your experience you've shared is really going to be beneficial for other students. Um, that's all we have time for. Thanks, Sasha, for joining us today and sharing your experiences of your degree and your career so far. Thanks for listening. Stay tuned and join us next time for more career conversations.